Hi, I'm Dr Rupert Suckling. I'm the Director of Public Health here in Doncaster. Our infection rate for COVID has been up and down over the last week, but currently stands at 36.6 cases per 100,000 people for the period the 16th to the 22nd of May. We did expect to see some fluctuation as we were allowed to mix together more, and these figures over the last week just show how important it is for us to continue to stick to the guidance and the basics of hands, face, space and ventilation. It's good that hospital admissions remain low, and we're really starting to see the impact of vaccines. We've looked at our latest vaccine data, and by early May, of the 128,000 first doses of vaccine received in Doncaster, only 261 people subsequently went on to test positive for COVID. And when we exclude those people who had a positive test within 2 weeks of their vaccine, so before the vaccine is effective, only 126 people tested positive, and of those, only 3 needed hospital treatment. This shows that only 1 in 1,000 people who've had the COVID vaccine have tested positive, and this just goes to show that getting vaccinated makes a real difference. Not only does it prevent you getting COVID, but it also, if you are unfortunate enough to get COVID, it means it's likely to be a much less severe illness. On vaccination, I'm pleased to say that Doncaster Clinical Commissioning Group confirmed yesterday that 300,000 doses of COVID vaccine have now been given to Doncaster residents, so that's first and second doses combined. This is testament to the hard work not only of our health partners, but also everyone who's volunteered to run the vaccination centres. I can confirm that we're aware of some cases of the variant of COVID that originated in India in Doncaster. We had expected this to happen, and the public health team is managing the situation with those individuals. All of those identified have been advised to self-isolate, and we continue to monitor the situation closely, but none of those people have needed hospital care. It's worth also noting that from yesterday, Public Health England are publishing variant of concerns figures for each local authority, and our number stands at 10. There are still 3 very important things that we can all do to keep our community as safe as possible. We can get vaccinated as soon as we get the call, we can test regularly, and we can isolate promptly and properly as soon as we're advised if we are contacted or we get symptoms. These 3 things are still vital in ensuring we can continue on the road to normality, and as well as ensuring that we all feel safer as we move out and about more. I'm sure many of you will have plans for the bank holiday weekend, and the good news is the weather forecast looks much better than it has been in recent weeks. I'd encourage everyone to consider the risks of whatever you're doing and make safer choices. Remember, outside is always best if possible when meeting up with others. Finally, the delayed European Football Championship start in mid-June, with England having some friendly games before the competition starts in earnest. And again, I'd ask you to enjoy the games safely, whether out in Doncaster or at home, and remember the rules on household mixing. Thanks for all your support so far. I'm sure together we can get through this. Let's still do it for Doncaster. Thank you.